Welcome to This Week in Pediatrics. This week we are covering 10 notable papers spanning preventive health and vaccine implementation, advances in neonatal and infant intensive care, and practical updates in pediatric emergency medicine and gastroenterology. Let's dive in. We begin with a critical look at preventive health and immunization strategies, starting with a large-scale study published in Pediatrics that quantifies the life-saving impact of seasonal influenza vaccination. Influenza-associated pediatric mortality remains a tragic reality, with reported deaths in the United States ranging from 37 in the 2011 to 2012 season to 289 in the 2024 to 2025 season. To evaluate how effectively the vaccine prevents these deaths, researchers conducted a case cohort analysis spanning from August 2016 through July 2025. They analyzed 1,234 laboratory-confirmed influenza-associated deaths among children aged 6 months to 17 years, comparing their vaccination status to coverage rates in survey cohorts. Among the 1,086 deaths with documented vaccination records, only 23% of children with underlying medical conditions and a mere 13% of children without known conditions were fully vaccinated, despite an average vaccination coverage of 49% in the comparison cohorts. The analysis revealed that influenza vaccination is highly protective, with an overall vaccine effectiveness of 80% against pediatric death. When stratified by health status, the vaccine reduced the risk of death by 77% among children with underlying medical conditions, and by 87% among those without known conditions. These findings underscore a vital clinical message. Seasonal influenza vaccination is exceptionally effective at preventing mortality, and clinicians must aggressively advocate for vaccination in all eligible children, particularly because a substantial portion of pediatric deaths occur in previously healthy, unvaccinated individuals. The challenge of vaccine uptake is further highlighted in a study which evaluated the real-world uptake and effectiveness of the KP.2 adapted BNT162b2 COVID-19 vaccine in children. This retrospective cohort study utilized linked claims and vaccine registry data from California and Louisiana, tracking over 2.6 million children under the age of 18 from August 2024 through March 2025. Shockingly, only about 2% of the eligible pediatric population received a single dose of this updated formula. Children who did receive the vaccine were more likely to live in California, have commercial insurance, and have a history of prior COVID-19 or influenza vaccinations. Despite this low uptake, the vaccine demonstrated clear clinical utility. Across all age groups, the pooled vaccine effectiveness against medically attended COVID-19 encounters, which included emergency department, urgent care, and inpatient admissions, was 43%. This study reveals a frustrating paradox. The updated vaccine provides significant protection against severe or medically attended illness, yet public health efforts are falling short in achieving meaningful coverage. Moving from viral vaccines to monoclonal antibodies, we look at respiratory syncytial virus prevention. In Spain, a population-based cost-benefit analysis. The study followed 37,689 newborns during the 2023 to 2024 respiratory syncytial virus season. Universal immunization proved highly cost-beneficial from both a healthcare and a societal perspective. The internal rate of return was 62% at a base price of €209 per dose, and remained economically favorable up to a price of €330 per dose. At the base price, the intervention was cost-beneficial in 100% of the probabilistic simulations, driven by a substantial reduction in primary care visits, emergency services, and intensive care hospitalizations. However, successful implementation of such highly beneficial interventions is not uniform. A retrospective study in the Journal of Pediatrics examined respiratory syncytial virus immunization rates among mother-newborn dyads at a single tertiary medical center system in the United States. While 74% of the 1,156 mothers received the respiratory syncytial virus vaccine during pregnancy, significant racial disparities emerged. Maternal vaccine uptake was highest among Asian mothers at 85% and lowest among non-Hispanic Black mothers at 59%. For the 302 newborns eligible for nirsevimab during their birth hospitalization, 55% received the immunization. Here, uptake was highest among Asian newborns at 83% and lowest among non-Hispanic white infants at 47%. The researchers noted that maternal and newborn immunization was strongly associated with a general acceptance of newborn medications, and that maternal age, insurance type, and religion also influenced uptake. Crucially, the birth hospitalization represents a highly structured environment where clinicians can actively work to mitigate these disparities by ensuring equitable counseling and access. Our second theme focuses on neonatal intensive care, beginning with a critical question regarding nutritional support and neurotoxicity in extremely preterm infants. A single-center Bayesian randomized trial. The study enrolled 134 infants born before 27 weeks, or weighing 750 grams or less, randomizing them to receive either a lower maximum lipid dose of 1.5 grams per kilogram per day, or a standard higher maximum dose of 3.0 grams per kilogram per day through the first 14 days of life. Bilirubin neurotoxicity was objectively measured using brainstem auditory evoked response wave V latency. The trial found that the adjusted wave V latency did not differ significantly between the groups, indicating that the lower lipid dose did not reduce neurotoxicity. Interestingly, while overall unbound bilirubin levels were comparable, infants in the higher dose group experienced a higher frequency of elevated unbound bilirubin levels of 30 nanomoles per liter or greater, and 40 nanomoles per liter or greater, even when total serum bilirubin levels remained low, between 3 and 8 milligrams per deciliter. Since growth and other clinical outcomes were comparable between the groups, these findings suggest that while a lower lipid dose does not alter auditory pathway conduction, the higher lipid dose may increase free bilirubin levels, pointing to the need for a larger multi-center safety trial to fully evaluate lipid dosing in this vulnerable population. In contrast to intensive neonatal monitoring, a clinical overview in pediatric research explores a more family-centered approach to managing neonatal jaundice, home-based phototherapy. Comparing home phototherapy to traditional in-hospital phototherapy for late preterm and term infants without risk factors for neurotoxic hyperbilirubinemia, the authors found comparable therapeutic efficacy. The primary clinical benefits of home-based therapy are psychosocial and developmental, including the preservation of parent-infant bonding, reduced parental stress, and improved overall family well-being. Additionally, home-based therapy allows for uninterrupted breastfeeding and reduces healthcare expenditures. Although the main disadvantage is the reduced direct oversight by healthcare staff, the rate of readmission to the hospital was low, and parental and nursing satisfaction were consistently high. This review highlights that with rigorous patient selection and reliable monitoring, home phototherapy is a safe, effective, and cost-reducing alternative to hospital admission. For neonates facing the severe challenge of hypoxic ischemic encephalopathy, a multi-center study in the Journal of Pediatrics evaluated the prognostic value of multimodal neuromonitoring during therapeutic hypothermia. The study included 128 neonates born after 35 weeks who underwent cooling therapy. Researchers monitored amplitude-integrated electroencephalography and cerebral tissue oxygenation via near-infrared spectroscopy across the first 96 hours of life. They found that a higher seizure burden, the absence of normal sleep-wake cycling, and a high burden of cerebral tissue oxygenation of 95% or greater were significantly associated with more severe brain injury on early magnetic resonance imaging. Furthermore, these same neuromonitoring abnormalities, alongside absent sleep-wake cycling, inversely correlated with cognitive and motor scores on the Bayley scales of infant development at 24 months. Interestingly, higher arterial blood pressures during the first 24 hours of life were associated with better long-term neurodevelopmental scores, while measures of cerebrovascular autoregulation did not show a significant correlation. This study demonstrates that combining continuous electroencephalography and cerebral oximetry provides clinicians with highly accurate real-time prognostic information that can help identify which infants might benefit from future adjuvant neuroprotective therapies. Our final theme addresses practical challenges in pediatric emergency medicine and gastroenterology, starting with a large diagnostic accuracy study. Clinicians in the emergency department frequently rely on clinical asthma scoring systems to guide disposition decisions for children presenting with acute wheezing. The Clinical Asthma Scoring Systems in Pediatric Emergency or CASPER study prospectively evaluated 10 common pediatric asthma scores, including the Pediatric Respiratory Assessment Measure, the Sirirach Clinical Asthma Score, and the Pulmonary Index Score, to see if they could reliably predict the need for hospital admission. The study enrolled 1,238 children, aged 2 to 18 years, who required bronchodilator therapy across 4 Australian emergency departments. Of these, 41% met the criteria for hospital admission. Strikingly, None of the 10 clinical scores met the predetermined diagnostic accuracy threshold of an area under the receiver operating characteristic curve of 0.80 or greater. The 4 best performing scores only achieved values between 0.70 and 0.73, and none achieved a Uden index of 50% or higher. While each 1-point increase in any of the scores was associated with increased odds of admission, the scores lacked the sensitivity and specificity required to serve as standalone decision-making tools. This trial serves as a powerful reminder that while clinical scores are useful for tracking a patient's response to therapy over time, they cannot replace comprehensive clinical judgment when deciding whether a child can be safely discharged home. Moving to gastroenterology, a prospective study in pediatric research compared 2 dietary strategies for inducing remission in pediatric Crohn's disease: the Crohn's disease exclusion diet and exclusive enteral nutrition. Exclusive enteral nutrition is highly effective but difficult for children to tolerate due to the complete avoidance of solid food. The Crohn's disease exclusion diet offers a more palatable alternative by combining partial enteral nutrition with a structured exclusion diet. This study prospectively followed 66 newly diagnosed children with mild to moderate Crohn's disease, with 33 receiving the exclusion diet and 33 receiving exclusive enteral nutrition. At week 6, clinical response rates were statistically comparable, with 76% of children on the exclusion diet and 82% on exclusive enteral nutrition achieving response. Mucosal healing, defined by a mucosal inflammation non-invasive index of less than 8 points, was achieved in 48% of the exclusion diet group and 33% of the exclusive enteral nutrition group, which was not a statistically significant difference. While the exclusion diet showed a trend toward a lower risk of clinical relapse within the first year, this association did not persist after statistical adjustment. These findings support the use of the Crohn's disease exclusion diet in routine clinical practice as a highly effective, more tolerable and comparable alternative to exclusive enteral nutrition for pediatric patients with mild to moderate Crohn's disease. Finally, we review a systematic review and meta-analysis, a condition that frequently causes significant parental anxiety. Analyzing 21 observational studies comprising over 3,300 children, the researchers sought to clarify both acute seizure clustering and long-term recurrence rates. The meta-analysis revealed that acute multiple seizures are highly common during the initial illness, occurring in 57% of children. Children who experienced multiple acute seizures were typically younger and had slightly lower serum sodium levels than those with a single seizure. In contrast, the pooled long-term relapse rate was low, ranging from 9.8% in the primary analysis to 6.1% in a sensitivity analysis that used a stricter definition of recurrence. Exploratory analysis suggested that age under 18 months and a family history of convulsions were associated with long-term recurrence, though these remain hypothesis-generating factors. This study provides crucial reassurance. Although acute seizure clustering is highly prevalent during the initial diarrheal illness, the long-term risk of epilepsy or recurrent convulsions is low, allowing clinicians to confidently counsel families on a highly favorable long-term neurological prognosis. If you only have time for one paper this week, make it the CASPER study on pediatric asthma scores from the Archives of Disease in Childhood. This multi-center study challenges the clinical utility of 10 widely used asthma scoring systems in the emergency department, demonstrating that none of them possess sufficient diagnostic accuracy to reliably predict hospital admission after initial bronchodilator therapy, reminding us that clinical judgment must remain paramount. Here are the key takeaways from this week in pediatrics. First, seasonal influenza vaccination reduces the risk of pediatric death by 80% overall, providing robust protection for both healthy children and those with underlying medical conditions, highlighting the need to maximize vaccine uptake. Second, while the KP.2 adapted BNT162b2 COVID-19 vaccine is 43% effective at preventing medically attended encounters in children, actual uptake remains critically low at just 2%, representing a major public health gap. Third, do not rely solely on clinical asthma scores to decide on hospital admission in the emergency department, as none of the 10 major scoring systems meet the threshold for high diagnostic accuracy. Fourth, the Crohn's disease exclusion diet is a highly effective and more tolerable alternative to exclusive enteral nutrition for inducing remission in pediatric Crohn's disease, offering comparable clinical and mucosal healing rates. Fifth, in infants with convulsions and mild gastroenteritis, reassure families that while acute seizure clustering is common, occurring in over half of patients, the long-term recurrence rate is low, hovering around 6% to 10%. That's your roundup for this week in pediatrics. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.